had this high school mate who was the most brilliant in our set. He's a shadow of himself right now. And this is how it began. His dad used to send him to buy cigarette. He buys a pack for the dad and buys 2 sticks for himself. You know, one thing with addiction, the excitement you got the first time, you will always want to catch up with it. So you increase doses. That's how he graduated from just cigarette.
I had a patient recently. He had 500 million inflow. 400 million went to substance use. In a year.
Recovery is possible, but it's not guaranteed. It's expensive. Rehabilitation is expensive.
Caleb Jeremiah is the Executive Director of CIDAA Foundation and a drug abuse prevention expert based in Abuja. He works on addressing substance abuse and strengthening prevention efforts among young people.
If we do not pay attention to controlling substance use, we will pay for it. As parents, we will pay for it. The boy under the influence drugged his mother, raped her, and got her pregnant. She almost committed suicide. Because how will she tell the story?
Welcome once again to another edition of Beyond Addiction Podcast. As always, I am Amadin, Ogbewe, your host. As always, I'm also joined here by Dr. Hope Omeiza. He is my co-host and is always here to also provide that structured part of the program. Today, we want to shine a light on an interesting part of the issue of addiction, which is how social media is foiling addiction and what we can do about it. So it's a problem and a solution, mostly solution-based episode today. And to do that, we have a perfect guest. He is at the intersection of IT and drug abuse awareness. And that's the perfect blend to really break down this issue today. I'm talking about Mr. Caleb Jeremiah. Welcome.
Thank you very much.
Welcome. And before we get into anything, I have to tell you congratulations. For those who don't know, Mr. Caleb just got married this month, actually.
Last month.
Last month. Congratulations.
Thank you very much.
That's still very new to have brought you out of, from your honeymoon.
Oh, I'm so sorry. That's how serious the business is.
I finished honeymoon long ago. I did for just 2 weeks.
Advocates don't do honeymoon for a long time.
Yes, indeed. There's no time.
I'm enjoying with the fact that my wife is not here. So.
Okay. That's great. It's great to know. I hope to join you sometime. I wish I could say soon, but I don't know. Nobody knows.
It's in your hands.
It is?
Because the Bible says he that finds a wife finds a good thing. So you need to do the finding and the preparation.
Capacity to find.
Put it.
That one did too. So, but anyway, let's go straight into it now. About your story, before we get into what you're doing, why? What came into your, what happened that made you say, you know what? I'm not just going to be someone who is by the sidelines. I want to do something. And then you founded your organization and you've been doing so much for quite a period now, about 2019, 2018 or there.
Yes.
So what happened? Why did you get into this?
Okay. First of all, I want to say thank you for having me.
Thanks for coming.
Pleasure's all mine. Yeah. I had this high school mate who was the most brilliant in our set. But he ended up as he's a shadow of himself right now. And this is how it began. This guy, his dad used to send him to buy cigarette. So he goes to buy cigarette for the dad. After a while, he buys a pack for the dad and buys 2 sticks for himself. After a while, he buys a pack for his father, buys 5 for himself. Now, he graduated to buying a pack for his dad and a pack for himself. Now, after a while, one thing with addiction is that the excitement you got the first time, you will always want to catch up with it. So you increase doses.
That's
you
tolerance.
Get it. Yes, that's tolerance. You get into a multiple drug use. So that's how he graduated from just cigarette to adding some other stuff. And that guy today became a shadow of himself. So after school, I thought of the fact that guy would have been somebody very important in the society today because he was very brilliant. Very brilliant. So he actually eventually went into university, but he went into cultism. And the drug use increased. And today he's a dropout. And I felt I need to provide solutions because a lot of young people out there are exposed to substance use. You understand? Just like the statistics we have, 1 out of every 7 persons have used
a substance in
the last 1 year. And 1 out of every 5 that use substance have drug use disorder. And 1 out of 4 persons with disorder is a woman. And mind you, women go faster from first-time user to problematic users. And you see, that's a challenge in our society. Why? Because women tend to have multiple drug use partners. If it ends here, for instance, Mr. A is a drug user, Mr. B is a drug user. She knows Mr. A, she knows Mr. B. If there's no drug here, she has access to Mr. B.
It wouldn't that be the same for a man?
No, not really. Not really. Men tends to opposite attract. Men tends to invite because what happens after substance use? You get.
Yeah,
you don't get it.
I did. What even struck me when you talked about he had a drug use issue, and then he ended up, with cultism. It felt like, is there a link there in the first place? Because it almost feels like that was a natural progression in the negative light.
Now, the thing there is, substance use and crime is not usually the case, but there are tendencies. In our profession, we say substance use is not a criminal justice offense, but a public health issue. You understand? Everyone who uses substance need help. They need support, not incarceration. You get. So usually, we would not say there is a link, but there are tendencies because most people who commit crime don't like to do that with their sound mind intact. They try to get something that will give them the courage to do those things. You get, and mostly it is substance.
Yeah, Ambassador, that reminds me about a research we carried out, like an interview in a tertiary institution somewhere in Nasarawa State. I also know that you do some works in Nasarawa State as well.
Yeah, and we're planning one for the World Drug Day already.
You're always planning so many things. So, and this young lady was interviewed, and she said that by weekends, what ladies do, come into Abuja and try to hustle. And they were interviewed. How are you able to manage doing this kind of business, with your clear mind? And she said, clear mind care. They take a lot of substances to, reduce their natural social inhibition to those activities, just so that they're able to fare in that environment, right? Now, we've also recorded that some bandit hideouts have been discovered with, drugs.
Of course.
Right? In fact, I even hear one time that some people requested as part of their ransom.
Some of the
tramadol or so.
Yeah.
Cigarettes
and all of that.
Yes.
So again, that underscores what Ambassador said, that you see, most times some of these crimes, even though they are not directly linked, but it reduces the inhibition, the natural inhibition that you would normally have towards these behaviors. It reduces that inhibition. Yeah. So you can find the easy link, therefore, with drug use disorder or addiction and cultism, which is also a big vice that is bedeviling our tertiary institutions.
Indeed.
Right. Now, Ambassador, you mentioned a father who was a user himself, nicotine in this case, right? And then one may think that nicotine is not a big deal. It's not a drug.
Indeed.
Right? But, and you see, I remember one of the trainings we have had together, we're taught that there's nothing like soft drug.
Yes,
all drug is drug.
Yes.
And I think that on this podcast, you're going to maybe decipher, let our viewers understand that there's nothing like soft drug and there's nothing like hard drug.
Even paracetamol.
Yeah, because when you say soft drug, it psychologically tells people that, you can use it, it's soft. Leave the hard ones. However, the so-called cigarette and even alcohol are drugs in themselves.
Yes.
And then we refer to them psychologically as gateways to other substance of abuse.
Does this include prescription drugs?
Of course, yes.
Of course.
So even a paracetamol shouldn't be soft drug.
The fact is, most of the medication people use have addictive content. You understand? And for instance, codeine is a cough syrup.
Yes.
And it is written there that do not go close to heavy machines after taking them. You understand?
Or driving cars or stuff.
You understand? It is because of the effect. Now, alcohol, for instance, costs over 6-point-something million% death around the world, according to the World Health Organization. The cause is cancer, heart diseases, kidney diseases, liver diseases. You understand? And somebody will tell you just a little quantity will do. Some people even use the Bible, take little for your
in moderation.
Anyway, but I think that's even for physical consequences of alcohol use.
Okay.
You're not talking about the social consequences.
Okay.
And even financial consequences.
Okay.
Now, about the Bible saying take a little for the stomach's sake, what do you have to say about that? Because people have rationalized the use of alcohol for this purpose.
And if I want to add something, one might wonder, if it's so bad, why isn't it banned? I mean, it must be okay if people advertise, people sell it. It's a big business.
The government receives taxes from the sales of
exactly.
alcohol.
So one might argue, what's the problem there?
It's policy issue. So as a matter of fact, we have policy gap. Most of our policies are obsolete because they were there before social media came in. So we have to do a lot in the policy gap. We have to create new policies. And the problem with our country, if I must say, is that we have a lot of wonderful policies for implementation, political will. You understand? Most of them has been implemented. Most of them have been passed. Most of these bills have been passed. But the political will
to implement
them is the issue. You get.
So it's an implementation problem, not a policy problem.
Not a policy problem.
Very good.
But most of our policies are obsolete.
Is there anyone, you said some of them are good. Are there anyone or any that have taken into account social media and what it does? If they aren't, what exactly are you proposing at this point? What's something that would help?
For instance, age limits for purchase and use.
You want to raise it up?
We should raise it.
Why?
Because you see, for young people, their systems, their brains are still developing. And the intake, the introduction of substance disrupt development. Are you getting it?
Yeah.
And secondly, they would have been matured enough to make adequate and positive decisions for themselves.
So what age are you proposing?
Like in developed countries, we have 21. Like in the US, we have 21.
I hear it's 18.
For purchase and use. You understand? And not just that you look big that you can purchase. Identification, they use identity. You understand? To ensure that you're actually of that age.
Yeah.
Then one of our policy defects in terms of alcohol, like we have the 200 mils and below, the sachets and the PET bottles of alcohol. It has gone far, but are we implementing them? We are not. And it has created access. Access. It is easy for young people to buy, and it is accessible to schools, to homes. You understand? So one of the policies we're actually pushing is restrictions of this substance far from residential areas and far from schools.
Okay. Is there anything we're proposing regarding the sales of sachets containing alcohols?
Yes.
Or the PET bottles?
Yes.
Now, you mentioned the age for US as 21 years.
Yes.
Now, in Nigeria is 18. So do you see we're doing better than the US?
We're not doing better than the US.
Okay.
The US, they have lifted theirs to 18. So because the difference between 18 and 21 is 3 years. In 3 years' time, someone who is still a teenager should have been matured enough, a little bit matured enough to make proper decisions for themselves.
Okay, so if in Nigeria, you can't use or purchase alcohol if you are not above 18, correct?
Yeah.
Now, so...
no, but that's not actually the case.
Yeah, so that's implementation.
We have younger... Yes. Yeah, that's why I say we have that, but the implementation is not there.
I've been a big advocate, of the fact that Nigeria is not a policy need country, but an implementation need country.
That's right.
Now, but the issue is this. Why the policies are there? Why we can't implement? What is the reason we can't implement? Is it just the will of the workers that should implement this? Because the president will not come down from Aso Villa and implement those policies. It takes the foot soldiers of the government that are called civil servants, right? Now, if there is no budget for those implementation, because recently I had an email to the National Return Agency and I said, come on, why don't you guys have messages to create awareness, given the platform that NOA has in Nigeria? Why don't you people advocate against drug abuse? Why leaving the work only for NDLA? And the response was, do we have a budget? Because for every agency, department or ministry, there are budget lines. And in each budget, you see, for this advocacy, particularly for this advocacy, is the amount stipulated for it. Now, are there such budget lines in a ministry or an agency's budget for advocacy against drug abuse? Are there such budget lines? That's one. Even if there are the funds released for those projects? So I think that's where we should begin to talk so that we don't get ourselves stuck where the problem is not. For instance, if it's implementation, but there's no budget. So if there's no budget, there's no implementation.
That's where political will comes in.
Okay. So who do we talk to for political will?
The political will, the president of the nation. If he wants, before passing this, is he really interested or just for paperwork?
Now, from my own understanding, I think that every ministries bring in what they want to do per year.
Yeah.
To the Oga Patapata, the president, right? And they are going to probably have their FEC meeting and then okay those things. Then you go to National Assembly and do your all the process, defend your budget and the rest. Now, if the people in those ministries do not include that their agency have the statutory responsibility by the act that establishes them to carry out this project, and they see the need to carry this because the president cannot be everywhere. But these ministries have departments and offices in all the states in Nigeria, and they get reports from their various states, right? So if they don't see the need and prefer those needs in their budgets, then what are we talking about? Is this the president?
But
now,
isn't that just a moment, please?
Yeah.
Is a presupposition that perhaps the person who was meant to put it there wasn't even aware in the first place?
Exactly. Or he doesn't see the need to put it there.
Okay.
But advise the president.
I'm always playing devil's advocate here. Just in time, a minister once spoke to me, I won't say what administration or what president, about how he had a grand plan to fix a sector. And he wrote it down, put everything, and he went to the president and said, Mr. President, if you do this, we are solving this issue within the next. And I said, we don't have that money. Go back and half is another word. Cut it down by 60%. And he said basically since then, he has just been coasting, doing what he could. But that was the best he could. But this is just to play devil's advocate. But I'm just saying that sometimes that could also be the problem. I understand you are also an IT consultant, PR. So what do you think when you see how drugs are being marketed these days? What comes to mind? I mean, the fact you've already spoken about alcohol shows that you are not only when it comes to substance abuse, like, okay, Dr. Hope said we shouldn't differentiate between drugs. I was about to say hard drugs, like cocaine and all the rest. So you're also aware of, alcohol and those other ones. When you see the marketing and all of those things, what comes to mind and how it's influencing youths and other persons?
Now, you see, the problem is not actually the drug. The problem is how they're being normalized, how they're being glamorized and commercialized. And the major drivers of all this is social media. You see, social media before social media and now, there's an increase by 65.7% used by young people today.
With the advent of social media.
You can see. So, increasing awareness with what I do, aside what we do, we visited several states in Nigeria because prevention is what we expertise. Like rehabilitation. Prevention. What's prevention? Trying to inform people enough to make positive decisions in making positive choices on not to use drug or any other substance.
I feel that can work when they're saying the normalization. Like, I think there's a counter thing. You're saying this is what could happen if you do it, and someone is saying, I'm having fun here. Let me just give you an instance. I want to read a tweet out here. I think this is what someone posted not so long ago, 7th of May, 2026. Scottish Loud versus Canadian Loud. Which one makes you chill and relax the most? Vote and drop your experience.
Can you imagine?
And then
on X Space.
Yes, and there are actual replies. Let's take some replies. One says, "Scotty crush no sweets. When I dey low on funds, I roll my Scotty in a different way, sha." This other one says, "Scottish no fit ever give you Kana vibes. We only smoke Scottish because we can't afford Kana." And then finally, this fellow says, "Scottish nice, but you know fit compare Mercedes and Lexus. Though we know it's both nice cars." Now, when we talk about normalization, this is like people talking about Arsenal and Manchester United.
Yeah.
So when you're coming in and you're trying to preach the message of prevention, how do you counter this level of normalization?
Now, these people, they are not at the point of prevention. You understand? What someone like this needs now is treatment.
But the people who are watching them, who are saying that,
yes, we increase awareness.
All right.
Increase awareness. So more people, the fact is, it starts from families. You see, substance use have ripple effect. That it affects the individual, it affects the family, and it affects the community, then the society at large. You understand? So from the family, if there's enough sensitization, for instance, I got my sex education very early.
You, sir?
Yes, very early. There are things I never did as a young child.
I'm really surprised to hear that. Because I assume you're a millennial. I didn't think our generation of parents were that exposed.
No, my parents did that. Especially my mom. She had the time with us to tell us. And my mom did not just give us abstinence. She gave us abstinence and protection.
Stay.
You understand?
Is that harm reduction? Drugs?
Yes, harm reduction.
Harm reduction.
So in cases where you cannot abstain, what do you do? You get. So someone at this state, what they need, you see, it's in 3 phases. Prevention. You understand? Treatment. Now, you prevent so they don't start. But if they have started, what do? You give them adequate support to help them come out. So they don't get to problematic use. Then people who had gotten to problematic use, they need treatment to go to visit Dr. Hope's facility. You get. So that is why even on the media space, we need to increase awareness. The more the people who are telling them, try this, try that, the most we have telling them these are the dangers. Don't go there. Not as if we want to judge these people. As professionals, we are there to give them right information because they don't have it. And a lot of people go into substance use without knowing what they're going into. So first, the family have to tell them the truth. Tell them this and that. That is why we, in part of our jobs, we educate parents and the community. So if your parents had told you, when you come and you have started doing it, they know the signs because we have taught them. You get. So it starts from the home, then the school. That's why we go to schools. We have visited virtually. Which state haven't I been to? You understand? You go to schools, you tell them, you educate teachers, you educate students. That is why one of our policy advocacy, we want substance not to be sold close to school and residential areas. So if we have more people on the social media saying no.
I just want to quickly point something out. It's a slightly related topic. When it comes to journalism, right? It's become open to the point that everybody is a citizen journalist. If you have followers and you have reach, you post things, you might even have better reach than traditional media houses. And what used to happen is that the veterans, they say, I'm bigger than that. I'm a professional. Why should I be on social media with you? These people, they don't have any training. They don't know anything. So they relegate the spaces of social media to the hands of people who don't know because they feel I'm not on your level. So when you say, okay, on social media, we need to be there as well to counter, because if you say, well, this page is beneath my concern, there's a blogger or it's just an influencer or somebody who shouldn't, have a say. it makes sense that you should also be there, at least for posterity's sake. Let it be that somebody tried to search and they found both sides. But are there creative ways you think that can appear? Because if you are coming online and you are saying, this is the danger, some persons might be a bit bored and say, are you trying to preach or teach to me? So what do you think are creative ways to handle that?
Now, the fact is, we have influencers, we have celebrities who do not use drugs. Yes. The biggest in Ghana is Sarkodie. Sarkodie has never smoked, he has never drank.
Well,
you don't agree?
No, I don't know. I don't know about Sarkodie. But I struggle. I'm struggling, but it's fine.
I lived in Ghana for 6 years. I schooled there. So I can tell you, I knew Sarkodie in Tema before he started. Sarkodie is born into a Christian family. You get, even though when it comes to some other part, like something happened between him and his wife that, okay, when you say Christian family, why did he now do this? Well, he corrected it. He married the lady when every other person think he shouldn't. Now, talking about drugs and followership, influence a certain individual can, but Sarkodie doesn't do drugs. So that is one example. We have him and he has several followers. He has built up several people and he passes the same message to them. You get? And young people, if you try to judge them, they'll run away.
True.
So they need safe space where they can express themselves, where they can be heard and seen. If you can do that, you can bring your people. I do that a lot. I have lots of young people who have actually gone. You think this one is on his way. You understand? But they are back. One, they see you, they respect you, they can listen to you. Most of them don't listen to your parents anymore. Parenting in this dispensation is very, very difficult. You understand? As parents, you need to be intentional and you need to understand the trend. You need to understand the trend. So if you cannot, it's a challenge to coordinating this thing.
I also think that even though, we are looking at innovative ways, I would say that we should start from the known to the unknown. In medicine, you don't start talking about things that people cannot see. If you're also going to do an investigation for a patient, you start from non-invasive to invasive. So before I take your blood, I would think, is there a way I can get your urine first? And would that give me the same result as your blood? So I think that, again, talking about political will, some of the people you see posting and normalizing drug use on social media, some of them may actually be benefiting from the sales of substances. Some of them may be drug dealers. Drug dealers does not mean they don't have to be a drug baron, or a high-end seller of drug. No, it may just be somebody who sells, at least makes 100K every day from the sales of substance. And then while he put that kind of post that you read from X, suddenly people can enter his DM and say, what's up, bro? Can I get this? Can I get that? Because that's where he fits from, right? So I think that we have to consider investing into social media as advocates, right? I see the work you are doing at the CIDAA Foundation, right? And I also see your presence on social media. But you see, in Western countries, right, there are funding availability for NGOs, like yours, who carry out programs like this. Now, that way, you are able to even boost or paid partnership, get somebody like Sarkodie that you mentioned now. He's not just going to come and put his influence on what you are saying because he loves what you are doing.
That's right.
Somehow, so there are people, some influencers who do not even use substances. But again, if Heineken, for instance, invites them and say, come and be our brand ambassador, which further reinforces or normalizes the use of alcohol or makes it look good for younger people to use alcohol, he might just take the deal because it's juicy. Now, so what happens if, for instance, CIDAA Foundation is empowered and they can even pay and get an ambassador, a brand ambassador that people follows, that have the followership. Now, for instance, if ACC African CEO Club do not have the followership on social media, they can get an artist who has the influence and say, okay, come, we're going to pay you. Let's use your influence to reach people, because the whole aim is the rich.
Rich, that's right.
The whole aim is the rich.
Yes.
So the same way African CEO Club is investing into this podcast, do we have corporate organizations who would normally put in their funds to comedy shows, right? Can they now consider to redirect some of those corporate CSRs, right, to organizations like CIDAA, like Vigada, and say, okay, we want to invest into this project because it's bedeviling our society. All right, this is affecting us. Right? Can you guys have influencers push the message to reach the people they need to get to? Now, offline, your organization are in communities teaching young people, training students and all of that. But then again, even after school, they spend most of that time on the phone. Right? Now, so you talked about parenting and all of that. A parent, how will she parent as intentional as they are without having the right information? In Nigeria, for example, people are not even aware of the mental health policy. They are not even aware. They are not even aware. Look at the whole issues about the tax policy and all. How many of us in this room probably even know what the tax policy are? That means we need to drive more the information to reach the people that it matters to, so that we don't end up passing policies for ourselves.
When you say ourselves,
yes, Nigeria end up passing policies for themselves. I mean, the leaders, they pass policies that stays with them. It doesn't get to the people because the people don't get to know what policies are part. In fact, I don't even get to be part of the policy formulation. Do you understand what I'm saying? So now, for me, I feel that, for these social media issues, we must begin to also sponsor campaigns. On social media, from every level, on Instagram, on X, on Facebook, TikTok, everywhere, right? Sponsor campaigns, but this doesn't come cheap.
That's right.
Right? Because the people you are seeing using their platforms to promote those things, they didn't get there cheap. Some bought a page with followers already. Suddenly you're following an innocent page that looks good. You just wake up tomorrow and you see that they are now posting Kana. So if they now, assuming I have the money to buy a page that is posting Kana, and I delete those Kana posts and start posting say no to drug abuse, then maybe. And so one thing with people seeing the same thing over and over again is that they begin to sympathize. It's true. Initially, they become emotional towards it, then psychologically, then physically. I gave an example how there was a particular brand of chin-chin. They were always doing that advert on, I think, one of the AFCONs or so. One day, I didn't feel like eating it. But because, this is they're always advertising. Let me just see what is inside.
Yes. True.
Now, and these young people are curious.
That's right.
They are very curious.
Yes. I
have high level of experimentation.
Yeah, I have some examples as well. A friend of mine who is a PR expert, he did some jingles for sausage pie. I don't want to call the specific name. So he didn't end up going out, and he just posted a bunch of it on his status. Since that day, I've been buying almost every week. It just got to me. Yeah. But on the positive side, because why I was so curious about creativity is the people who are trying to get on social media and thereabouts, they might not be moved by a simple message of saying no to drug abuse. Let me give an instance. When I was young, I used to watch Papa Ajasco. The ads I watched on Papa Ajasco stay with me till today.
That's right.
And I noticed that at that time, I don't know if it was the NOA, there was this strong push to educate on protection, sex education. There was this, in fact, there was an episode where I think Papa Ajasco he wants to engage in bedroom activities, and he wears a full plastic bag because they said he should wear protection. And so the episode was made fun to show that that's not what protection is. This is what it is. And then in between, you are seeing this advert. So that creativity, I feel, is also needed to counter it, so that when, that the tweets I just read, they sounded very conversational and fun.
Yeah.
And so the person who's going to counter that can't come with medical talks and all of that. But that being said, you said something I feel was very instrumental, that person could even be a potential supplier.
That's right.
Let's talk about, your experience with IT and how you are figuring out this supply chain. So we've heard about WhatsApp, X, Twitter being used as places for drug supply. Can you tell us how that supply chain works?
Now, the thing there is, as a creative and as a professional, you have to maximize every space where you can pass your message. We are creative, we develop content, we develop designs just to show people exactly. And like what you said, if you want to get to the youth, you need to bring up something that will be more appealing, that will captivate their interest. Just like you made mention of Papa Jasco and the rest. That is it. For the youth, what will interest the youth? Skits.
Yes.
You get?
Yes.
Because drug has gotten access through social media to our phones, music videos, you understand, celebrity lifestyles, you understand, just like we've spoken about Sarkodie and the rest. Now, you have to bring up something that will interest the youth. And these days is skits. And because of the algorithm reinforcement, have you discovered that if you watch a certain kind of thing, if you watch a certain kind of thing right now, the algorithm will make you start seeing different content that has to do with that thing you have watched.
Yes.
You understand? So we have to create more content because people love to watch videos. They just scroll and scroll and scroll and scroll. So what are they seeing? Are there more content that will educate them? You get on the social media, on X, on TikTok. Most people are on TikTok today.
Indeed.
You are, my brother.
Yes, I am.
You see? You understand? So where would you find this your target, the youth? And how is your content being developed? You understand? It's something of concern. You understand? And it's not cheap.
Indeed.
Like what we're doing here today, it's not cheap.
Yes.
You understand? So the creativity matters a lot, and we are doing that.
Yeah, I just want to say something to anyone watching out there. There's a little test that I feel you can do to see what your mind space is or what you're viewing. Just go to your Instagram For You page.
Okay.
And just have a look. Don't open anything. Have a glance at what appears there. And it might tell you something. Some persons will come and complain, why am I always seeing backsides on my, you watched the backside, you clicked, you liked it, and then you watched another one, and you watched another one, and the other one's a tick. That's what you want.
That's what you want.
So I think everyone can do that test. I know for me, I'm probably going to see Pounded Yam and the books and all that.
Are you very sincere?
No, that's as much as I would divulge for now.
Okay.
but I was still curious about the whole supply chain happening across social media platforms. Just the other day, we spoke about a situation where we found that drivers, ride-hailing apps are being used to even smuggle drugs as well. So let's talk about that and the solution, to curbing these streams or methods of drug use and drug sales. Substance, pardon me, because it could be more than that.
Yeah, so to curtail this, first of all, we need government policy and implementation. For social media, there are no restrictions for now. So if we're able to restrict the kind of content people put online, that's one step. Then family-based prevention, which I spoke about earlier on. Excuse me. The parents should be more intentional and understand the trend. And there should be digital restrictions for children within a certain age. You understand? Then we also have school-based. Now, talking about school-based, we have to infuse this drug or substance abuse programs into school curriculums. You understand? And educate teachers. You get. Then the community leaders and all. If we do these things, we should be able to actually curtail substance use. Because if there are restrictions on whatsoever you're putting online in the Nigerian space, you cannot put certain things. But mind you, the industry will fight it.
Yeah, because it could be construed as an attack on freedom of expression.
Now, yeah, but there are limitations. For instance, do you know that if you put anything on TikTok against tobacco, it will be dropped?
Against?
Yes.
How so?
Check it. Mm-hmm. It will be dropped. The media platforms, you cannot talk against tobacco. Why do you think so?
I'm going to test this after.
Yes.
I'm going to post on tobacco.
Do a post. It will not fly. You get the tobacco industry is very rich and they are investing so much. So much. The alcohol industry is rich and they're investing so much.
And they are not sleeping on the social media space. That is why they would invest into TikTok to ensure that when you post against them on TikTok, it is flagged
down.
So there has to be a counter investment.
That's just it.
So, you mentioned content and of course the whole innovativeness that will come with those content, creation.
Yeah.
Right? Now, but if you do the content and there is no reach to your content, one day you get tired
that is it.
Of waking up to see that only one view, only one like, only one share. And that share is your wife that shared it.
So what's the role of tech platforms in all of this, if they have this much power?
Now, you see, it's not just talking about right now. We're talking about social media, right?
Yes.
Now, the media houses have to play a role. Are they willing to sacrifice? And that goes back to the investment we're talking about.
They are not going to sacrifice. See, it is business.
Yeah.
That's it.
Social media is somebody's business.
The profit angle. Yeah. What's the profit angle? What do you think, Dr.?
If I have...
Because if you tell somebody, do this say from the goodness of your heart, they're going to look at you.
You understand.
The goodness of his heart will not feed his family.
Indeed.
Right? If I have 10 million followers, for instance.
Yes.
Right? And then you have a new brand of a tobacco product. You are the sole distributor. You have just won the deal with them to distribute solely in Nigeria. And you need to clear your goods. You need to sell them off. Now you are paying me 2 million naira every week to share the post that you make. So if VGADA or CIDAA or African CEO Club now approach me and tell me that, you know what, I want you to help us share a post from this podcast where we spoke against young people less than 18 having access to alcohol beverages, buying and using. Meanwhile, somebody is paying me 2 million every week. That's 8 million naira in a month. So how much are you paying me? So from the goodness of my heart, I would now tell somebody pay me 2 million, saying I can't post the same, two contents that are against each other in the same, in my page. How would that work? Or you now tell me to stop posting for tobacco on my page from the goodness of my heart. There has to be a counter investment. And that comes from what he has said, policy. Now we can regulate that for just like it's not difficult through the tech.
Yeah.
For Uber drivers, if they get into the airport, the fees are different.
Yes, of course.
For some reasons, I don't know, maybe the authorities know that this is an Uber driver, and so the fees has to be high because somehow they have to bill both us, whatever. Now, so that means that we can also do that in Nigeria. Any influencer posting about alcohol or about this, increase the tax for them. Or flag it down. Otherwise, you can't operate in Nigeria. I think, was it President Tinubu that did something? What was it? TikTok. There was this company that did something that against the government.
Should be WhatsApp, I think.
Was it WhatsApp?
Yeah, they were told to pay certain amount.
Yes, so that means we have the tech capacity to control the kind of content that we want them or our people, our Nigerians, to post on those spaces. In China also, they have their own WhatsApp also.
Of course.
So you can control it. It's doable. Now, the aspect of people thinking, oh, you are trying to shut down our voices. You're trying to say, now that comes with enough awareness. You are not telling me the good in what you're asking me to do. I may not understand.
Yes.
Right? Even if it is for my own good, I will not understand. You have to educate me and educate me well. Make me see reasons. You are not forcing me. You have to make me see. And that again comes with investment. Because educating me will come with a lot of money that you use to get the message to me.
Yeah. What I wanted to add is, maybe what you just said, their education. Because someone might be wondering, if I'm getting 2 million a week from it, they are getting their profits. The people using the substance, they're happy. They're literally, their dopamine level is higher. You're happy, I'm happy. What's the problem? So I think sometimes maybe the issue might be relating it a little bit to what is the long-term monetary loss societally and so on that happens, So if a company, because we've been saying purely legal now, there's the legal aspect as well. If people are making millions of dollars from this thing, how is it costing the society? Is there a way you can put a figure to that so that people know that, yeah, somebody made 2 million a year, but the number of youths that were removed from the workforce led to much more millions in economic value?
Simple and short. If we neglect what goes online, we'll practically see the effect offline. Are you getting it?
Yeah.
If we do not pay attention to the negative stuff that goes out, it tells offline. So this is just the long and short. This is why we have to be concerned about what goes into our social media spaces. Because the resultant effect might not be very, very... As a matter of fact, yes, recovery is possible, but it's not guaranteed. Are you getting it? It's expensive. Rehabilitation is expensive. Dr. Hope is here. So if we do not pay attention to controlling substance use, we will pay for it. As parents, we will pay for it. Because we'll have wayward children. As society, just like you said, you will not be productive at work. You'll be relieved of your job. I recommended a family that we brought someone to Vigada from Kaduna. He has 2 jobs. He's working with the government and he's an entrepreneur. But he has abandoned his business. He is not effective at work anymore. He goes to work and then he go home. You understand? He's now a concern to the family.
Is an entrepreneur that had staff under him?
Yes, of course.
So those are other sets of people who have been affected.
Exactly. So when you're asking for the financial consequences, if somebody's earning 2 million naira, right? What does that earning? What's the consequence of that earning to the larger society? He has just given an example of someone who runs 2 businesses, one for government, one for personal, and he has employees, but now he's become dysfunctional. He can't work anymore, right? Now, do you know what it means? That means he can no longer bring out his intellect, his input into the work in the government. Now, people are earning from his business. Probably they'll be redundant. They'll become sacked. They'll be sacked now because he can't afford to pay them. Now, think about it. I had a patient recently who the brother said, this guy, they checked his account statement. He had 500 million inflow. 400 million went to substance use. In a year, about 500 million naira came into that account. But when they traced how the money went out, they were all to dealers, sellers of drugs. Now, do you see that? That's one person. Now, for every statistics, we are quick to say 14.3 million, 3 million Nigerians. Now, let's even say it's one person. Now, multiply that one person by one family. Because it's not only the index person that suffers.
That's right.
The family suffers.
That's right.
Parents have lost their lives because of the behaviors of their children.
Yes.
Parents, there are patient relations who are begging, can I pay installments? Because they can't even afford.
That's right.
How much is someone's pension? How much is retiree's pension?
Yes.
How much is it? And you're talking about 500 to be admitted in a private facility.
For a month.
How much did you say?
500, 600, 800 for general rooms in a month. Now, you would think, the house was making money from this. But that is where they have to feed 3 times daily. And they eat, bro.
Yeah, of course.
Right? Now, it covers the accommodation. The facilities are not in unsafe areas. They are probably in estates in highbrow towns in Abuja or in Port Harcourt. It's expensive. You have to pay experts. You have consultant psychiatrists. You have clinical psychologists. The minimum qualification for clinical psychology is MSc. Some are PhD. You have to pay them. It doesn't come easy, right? Now you have mental health nurses. You have counselors. You have support staff. You run on diesel or petrol or whatever. You pay NEPA bills. Do you understand what I'm saying?
Yes.
Now, and you have to pay other support staff, cleaners and the rest of the things. It's a lot to manage. So it's expensive to actually treat.
Yeah.
Now, and it's also expensive to keep your child. And even when someone's child is in the rehab, it is not only the child, even the families are in the rehab.
Yes.
Do you know why? Every time they ask the father, where is your son? He went to the US. He's in Port Harcourt doing a training program.
Yeah.
Do you know what it does to that man?
Yeah.
Every time he's sleeping and he remembers that, 2 kids are home, one is in the rehab, do you know how he feels? It's draining. Psychologically, mentally. A mother told us how she suffered panic disorders. We had to do treatment for him, therapy.
Yes.
Why? Anytime her phone rings, she starts having a panic attack. Why?
This is the mother of someone.
Who is
in the treatment.
Now look at what happened. Because every time she was called by unknown numbers and they call it, hey, are you the mother of this person? We have just caught your son. Come and carry him. Come to the police. Come to the vigilantes, whatever. And all the rest of the things. Now, simply because of that child who is suffering this disorder, now the mother now has developed a panic disorder. Why? Because of that behavior.
Yeah.
Now, do you see what your earning is causing? We're not talking society yet. Now, so if the future we are saying Nigeria is a future, the people who will bear that future on their shoulders are the ones that the drugs are destroying their mind, their brain, to make them dysfunctional, and then they cannot function in the larger society tomorrow. So if we now say, what kind of brain do we have among these? Now you're like, what kind of employees do we have now? Tomorrow, if we don't check this issue of drug abuse, you start thinking, what kind of human beings are these?
Yes.
And I think when I listen to a lot of doctors who've spoken on other health issues, they say there's something they call pay out of pockets. That, look, clean your environment, eat well, do these things that are considerably cheap, or you could get sick from, you left water stagnant and mosquitoes bred there. Now you have malaria. Now you have to pay, for the malaria drug. So I think when we're passing this message, it might not even necessarily be to those who are earning, because they don't want to hear. They are making their money.
Yeah.
But the people who are calling on, are those who have likelihood to invest. Now they know that there is a cost that for which some persons are benefiting. And this is why I need to put my money where my mouth is, because if I don't, I'm still going to suffer one way or another.
Do you know, most of the individuals that have donated to us are people who have had children use substance and who think about the children out there in the society because they know the pains they've gone into. A mother was raped by her son who has used substance.
Mothers have been killed by their children
and eventually got pregnant. So what do you think about that? Just like he's talking about family therapy. Now, when a child uses substance, that's why in every facility you have family section. When a young person uses substance, just like I said, it has ripple effect. You understand, the damages is not just to that person alone. The family. Okay, look at what I've just said. A boy under the influence raped his mother, drugged his mother, drugged her, raped her, and got her pregnant. So who do you think did help? She almost committed suicide. Because how will she tell the story? You understand?
Yeah.
So it goes beyond an individual.
No, a child under the influence that carries a pistol and hits the mother's head or stab the mother to death. These are stories that are live, not fiction.
Not fiction. So.
Right? These are stories that are live. It's not fiction.
I'm feeling down already.
That is what people are earning from.
It takes people who understand this aspect of it. The public health aspect. It takes an entrepreneur who has staff who had issues or who has a child who have had this issue to know how to handle stuff, to invest.
I'm still thinking about how you started this podcast, with the story of that young man that started by buying cigarettes for his dad. I'm sure the first time he didn't buy for himself
at all,
and then he started buying for himself until he now takes the same amount with his dad. This goes to tell our parents again that the environment matters.
Of course.
All right. The environment you expose your children to matters. There are parents who stock their bars in their homes with alcoholic drinks. Beverages. I'm not saying that is bad, but I'm also saying that alcohol and cigarettes are gateways to substance use. If this really is biting our society, who could change what we stock our bars with? Because if your child grows up meeting alcohol in the bar, then you want him to now think that or believe what ambassador is telling him, that alcohol is a gateway to other substance of abuse. So you are saying don't buy it, don't have access to it, but in the homes, they are seeing a bar with alcoholic beverages. So what are we saying? So you see,
the fact is our children today are concerned with what they see, not what we tell them.
Not what you tell them.
So which parents should be role models.
It's more of mentoring. They are more prone to copy what you do than do what you say. So if I'm even talking about access to alcoholic beverages until the age of 18 in Nigeria, it is in my house.
You have access.
I'm seeing it.
Your father comes back from work every day and
he takes a glass. He's watching you. And I think, don't take it to, what are you saying? He's seeing what you are doing. So he will go out and want to replicate, do what he sees you do at home.
But also, can I, again, it's like I have the tag of devil's advocate here. But like I said before, if it's something that is still legal and is still well known and is making so much money and popular everywhere, there must be an extent of the issue of moderation being fine. If someone is watching their dad drink responsibly, which is what they usually put on these ads, drink responsibly, and all of that, is it still an issue if really they have it under control? Because now I feel like there's a risk of, like we've said before, when the issue of sex education is happening, and we say if a guy touches you, you will get pregnant. So because of that extreme, it's counterproductive. So in the same vein, if people are hearing that, they've heard alcohol being mentioned, they've heard tobacco being mentioned, but these things are legal. So are you trying to scare, is it scaremongering? What's really going on? Is there no middle ground?
For alcohol, as part of the control currently in the policy development, there's an increase in taxation. You understand? If there's an increase in taxation, what happens is that the price of alcohol goes up. So the consumption level will definitely reduce at certain levels. You understand? So that's part of...
But consumption is not automatically bad, is it?
Now, the thing there is, let's not confuse people. Alcohol is not healthy. Let's not confuse people, because a lot of people, you've been...
So it's almost like a prison complete abstinence, no middle ground. That's my concern, I'm wondering.
So when you give middle ground, how will you control it?
But it's the same thing for sex education. There's abstinence and there's, if you can't abstain, protect yourself.
So what is the you want to dive into harm reduction. So what is the harm reduction now you want to prescribe?
No, I'm asking, because if it boggles my mind that something could be harmful.
Do you know what we tell young people? And
not be banned.
Do you know what we tell young people? Don't start so you don't get trapped.
Amadin, I think what we're saying here is someone less than 18 years, at least in Nigeria, you should not even use. You should not even be exposed to it. You know why? There are different levels of prevention. You have primary, secondary, and tertiary level. However, there are other two levels, the primordial and the quaternary level. Now, what primary does is to protect you from the risk factor. And we are saying that someone who is exposed early to alcoholic beverages is more likely, like he's mentioned tendencies, is more likely to want to use irresponsibly after the age of 18 years or even before the age of 18 years and even graduate to use of other substances aside alcohol. Right? Now, so if we are saying that we want to give the attention that drug addiction and abuse demands in Nigeria, if we are serious about it, then certain critical steps has to be taken. Right? Even though it's going to affect people who are enjoying it without having negative consequences on them. Because like he said, 1 in 5 persons who use would have a disorder, substance disorder. That means not everybody who use eventually have a substance disorder.
That's right.
But you don't even know whether it will be 1 in 5. You don't know your genetic makeup. You don't know your biologic makeup. You don't know. It's a journey. You don't know how it will go and how far it will take you. You don't even know your destination. Right? So it's important, therefore, that if we want to give it the respect and the attention it deserves, considering how far this is eating the fabrics of society, right? Then it is not out of place if we say, parents, don't drink in the full glare of your children. Go somewhere and drink. You don't have to put it in your bag, because if the law is saying don't have access until the age of 18 years, but in the house they have access to it. Are you not seeing the mismatch in what you are saying? I can't buy it outside. I can't drink it outside. But in the house, I can have access to it. That is not always at home. I can open it. I can, some children are so smart, they can remove the glass from the bar, replace it without you knowing. So that means you are bringing it to them. Right? You can educate them without handing it to them. So if they teach you sex education, do they give you a woman and say, take, as a man or as a lady, take man, well, a sex educator, you go and sleep with this man in the same room. Wake up, let's see how well you are utilizing the education we are teaching you. Is that what they teach you? So we are saying that drug education does not mean that you should expose the children, give them the alcohol, let them sleep with the alcohol in the house, and then you are educated. That's not education.
You have to wait to their mind.
That's normalizing. That's normalizing that behavior.
Speaking of normalizing, it reminds me of another post, still speaking on social media, of a young woman who said she smelt Canadian love. And she posted about how she went to the neighbor's room to knock and say, hey,
this thing feels good, man. That's what I'm saying. So primary prevention, like we said, deal with the risk factors, right? Primordial is don't even let the risk factor exist. Let's use malaria as a context. Don't let there be mosquitoes at all. That's primordial. There should not be mosquitoes at all. That's primordial prevention. But it is impossible in Nigeria and in tropics countries, right? That means there's always mosquito. There's nothing you can do about it. We always have mosquito. Unlike in the US, there is no mosquito. So then, primordially, no mosquito. If anybody has malaria there, it is that he has just traveled recently, right? Now, so primordially, no mosquito. But now there's mosquito. What do you do to shield yourself from the risk factor? Is primary. Secondary is detect early and treat. That's secondary. So that is where the whole, this person already have it now. Okay. Now detect it early. When it just start using. Detect early. Right counseling, therapy sessions, and all of that. So the support system available. Then if you use treatment, treat early. Right? Tertiary prevention is where you are trying to prevent complications. The person probably has had issues with the police. He's out of school. All those complications, family issues, no trust anymore. He's divorced. He has, he's at the verge of being sacked from the office. Complications, legal, social, all those things. You are trying to fix them. Tertiary. Now, quaternary. At this point, you are trying to ensure that the person does not over-medicalize or it doesn't suffer consequence from the treatment that you are giving. That's quaternary. So you see, both rehabilitation, both advocacy, all is under policy. It's under prevention. Right? So the policy and everything, they all come there are also policies to guide treatment too.
Of course.
You see, there's a lot to do and say. Now, look at it. There are people who, you mentioned something, Amadin, that people who are already selling, this message is not for them. It is also for them. I remember a program we had last year in Kogi State. And then after speaking to the public and all, somebody came out and said, I am a drug dealer. I used to sell. But after hearing this message, I will not sell again. Do you understand what I'm saying? So it will shock you that people who are doing this,
right?
Yes, it will shock that people who are doing these things do not even know. It's all about reframing, education, right? So it is not just for those who would invest. Even though if they don't invest, this message cannot go far and then have a better reach.
So you feel we can actually believe someone like that, that you can be part of the problem and not know?
In fact, he was on the road. Yes. Yeah, of course, yes, it's insight. He doesn't have insight. Do you even know the full consequence of what you are doing here now? There are people, you may think, this might reach 1,000 people, but it will shock you that maybe after 1 to 5 years from now, people are still listening to this and it's changing lives.
Yes.
I'm just struggling to get with a dealer. You are making money from this and you're coming to tell me you're sorry.
Yes, a lot of people have conscience.
Yes.
You didn't have the... Okay,
you have seen the damages it's causing to people. You understand? And you feel you don't want to be part of the problem.
Yeah, this is why we prioritize stories as well, because when you keep telling people statistics, 14.3, they don't get it. But when you tell them, this is what happened with this person, and it just starts to dawn on them. Perhaps that's what happened with that dealer.
Yeah. And then, of course, the kind of intervention that we carried out. And of course, the same thing with him is not just go and talk to people who do this. There's also a substitute. What are you replacing that behavior with? For the drug dealer, he saw that, okay, we're going to pick people who are using drug for 3 months, treat them for 3 months, and empower them. He said, then this is better. I'm a dealer, I'm a user. I want to stop if we're actually going to be empowered.
As you're now looking at the causative factors, why people have gone into substance. Some is adverse childhood experiences,
trauma,
some unemployment, poverty. You understand? So if you're not attending to the root causes why people have gone into this, no matter the level of treatment, no matter the level of prevention programs you do for them, nothing will happen.
It comes back to the same
because the same challenge. He's depressed. He's using alcohol or cannabis as a coping mechanism. It makes him feel good and forget his problem. If you're not tackling that root cause,
what's causing depression?
You understand? I handled 2 different families, anyways, from FUT Mina, and this boy was depressed. One, he was born after his father passed, and he had a father figure. Now, this father figure died. So this guy became depressed, and he was brought to us. So the mother did not know why this guy has gone into substance use. You understand? And what we do, we try to know the history. Just like medical treatment, you try to know the person's medical history. Discuss. How come? And we now discover the gap. Father figure, no father figure. The one he had left. So what do? You try to ensure that someone come in and play the father figure role. And immediately we got that intact. The guy was okay. He now have the father figure. He's in his 500 level, doing so well. I think last week or 2, the mom called me that, how can we get a laptop for your boy? He said he needs a laptop. He's coming back soon. He said he wants to go into fashion. I need to buy him an industrial machine. You can say the guy is now productive. Doing well, because the root cause, there's someone playing a father figure role in his life. That was his problem. That was what got him depressed. He needs a man he can speak to. You get a second guy in same school, FUT Mina, different parents now. Now the guy's problem was that he went into a fight with a lecturer, a bright student. He went into a fight with a lecturer. The lecturer said, you will not graduate. Now, this guy started having problems with courses that are not related to this man's course. You know how the university system works, networking. He said this guy will deal with him. He's not dealing with you by himself. It is his friends. And this is a bright student. This is a course I'm doing very well in. You understand? So what was the solution? We spoke to the boy and got to know the problem. What did we do? We launched it. I went to FUT Mina. I have a professor friend. We discussed and we saw how to get this person in. You understand? Now, this guy is good with his lecturer. This guy is now passing his courses. And this guy is good. This guy has stopped addiction. He stopped taking substance to cope. Because that is the problem. So if you don't deal with the problem, anything you tell this guy goes into deaf ears.
All right. So just to round off now, some of what you said there also shows that there are, like you said, online problems can lead to offline problems. So, and then we've been talking about possible online solutions, but apparently there are also offline solutions that can, lead, like the young man who's going to get a laptop and then connect with the world is free of the problem that started it up in the first place, because he's been empowered, he's been given a father figure, so to speak. So are there any final words you have for people who are going through this, especially some who feel that what surrounds them, like we talked about, the algorithm is pushing them one way and they don't know how to break that cycle?
What I have to say is people should find safe spaces where they can speak out. You understand? If you speak up, you get solutions. You understand? The challenge offline now is that a lot of people do not speak up. Speak up to get solutions and know who you're speaking to.
You can even ask online for help.
Yes, we are online. We are online. Caleb Initiative for Drug Abuse Awareness. We are on all social media handles. You can reach us. We attend to people on daily basis online. And you have Vigada. We don't have a facility for treatment of our own. We work closely with Vigada and other rehabilitation centers around across the nation. You understand? So, Speaker, reach out to us. We are not judgmental people. We are here to give you professional support, and you'll be fine. You'll be fine and productive to the society. So we are more concerned about what people see out there online affect what happens offline. You get the government policies should be intact. We need law reform because most of the laws we have are obsolete. Even most of them are there before social media came in. And I told you 65.7% increase of substance use after social media came into play. So that's it.
I just want to, appreciate the good work they are doing at Caleb Initiative, for drug abuse awareness. And it's been a long one, and I'm aware of the challenges that, they are also facing. I will tell you that it's not easy, when you have to even use your own pocket money.
Of course.
To fund all of this. So I feel that one of the things that this podcast should do for our viewers is not just to say, oh, wow, they are saying good stuff. Come on. But you see, to also see the need for investment, to see where to put your money for society good.
Thank you so much. It's been a pleasure and a very enlightening one. And I think that's how we round off today on that very specific note, investments. Here's how you can invest in us today. You can invest with your like, your share, your subscription, because this message needs to go around. It doesn't always have to be money. You can do something. See you next time. Bye for now.